Kumar Singh Jagutpal, Minister of Health and Wellness, Mr. 𝗬𝗲 Director General MRA, Permanent Secretaries of the Ministry of Health and Wellness, Mr. 𝗬𝗲𝗀𝗀𝗀𝗀𝗀, Dr. Bhushan Ohri, Director General Health Services, Dr. 𝗬𝗲𝗀𝗀𝗀𝗀𝗀, Director Health Promotion and Research, Directors of the MRA, President of the MRA Staff Association, distinguished ladies and gentlemen. Good morning, everybody. I'm truly delighted to welcome you all today to the launching ceremony of the MRA Health Week. On behalf of the MRA, I would firstly like to express our sincere thanks to Dr. the Honorable Minister Jagutpal for his distinguished presence in this event. I would also like to express our gratitude to the senior officials and all other team members of the Ministry for their presence, their contribution and guidance to conduct this event. I can say an event which will give the MRA staff the opportunity to avail of the health tests available and also the sensitization sessions to be conducted by doctors. The MRA is first and foremost an event about people, an event for our people. We consider our people to be the most important asset, and it is therefore fitting that this event is meant for them. In fact, we believe in our people, we value them, and we recognize their contribution in MRA's performance. But we also recognize that health is essential in the performance of their duties. And we recognize that health is vital in ensuring their happiness and satisfaction at work. Within this Health Week, I have no doubt that we will further allow our staff to benefit from several health screening activities, such as blood pressure monitoring, eyesight tests, diabetes tests, among others. Ladies and gentlemen, we are here today to launch the MRA Health Week because we want to continue promoting a culture whereby our people obtain appropriate advice from specialists, to empower them to take care of their own health and to advocate for it. Some of us have big ambitions. Some of us have big dreams about our career, our work. But we must also remember that the one dream, the one hope that we all share is to live a healthy life. Health is a gift we should all be given. The gift that will enable us to realize our dreams and fulfill our potentials. We are all aware that health is wealth. We need to recognize that well-being is an important component of our working life and of our workplace. Keeping our staff fit, healthy, safe is important, especially in a time where we still need to be cautious and protect ourselves against COVID and other prevailing diseases. So we must continue to focus our efforts to ensure that everyone, everywhere in the organization is able to enjoy the highest attainable standard of health. Let us maintain the focus on improving the MRA to be a healthy and safe to work. Human beings matters for us. Human capital is our human resource. We will never trade off the health and safety of our staff because our people count and every MRA staff count. Ladies and gentlemen, on this note, I would like to thank you for your attention and would now kindly invite Mr. 𝗬𝗲𝗀𝗀𝗀𝗀𝗀, Director General, to address you. Thank you.
Dr. the Honorable Kailesh Kumar Jagutpal, Minister of Health and Wellness, Mr. Desai, Permanent Secretary, Ministry of Health and Wellness, Dr. Bhushan Ohri, Director General, Health Services, Ministry of Health and Wellness, Dr. 𝗧𝗹𝗀𝗀𝗀𝗀𝗀, Director, Health Promotion Research, Mr. Manikam, Director, HRTD, my colleague directors and the members of the management team, the representative of the MRA Staff Association, distinguished guests, ladies and gentlemen, good morning. On behalf of the MRA management team and MRA staff, I have the pleasure to extend to you a very warm welcome on the occasion of the launching ceremony of the MRA Health Week. We feel honored to welcome Dr. the Honorable Kailesh Kumar Jagutpal, Minister of Health and Wellness, to launch this event at the MRA. We are grateful to him for having spared his precious time to be present within our midst despite his hectic schedule. Thank you, sir, for your magnanimity. We also have the pleasure to welcome in our midst this morning senior officials from the Ministry of Health, including the Senior Chief Executive and the Director General Health Services. We feel privileged and grateful to the Ministry of Health for assisting the MRA in the conduct of his health campaign. In fact, this year, through the collaborative initiative of both the Ministry and the MRA, we are able to organize a more comprehensive health program for the benefit of our staff. The aim of this campaign is to provide MRA staff with health facilities at their workplace itself, hence allowing them to avail of different health states and, more importantly, listen to the guidance and advice of the doctors on diverse health topics that are of prime importance. Ladies and gentlemen, as a responsible organization, the MRA considers the health and safety of its staff as an integral part of its mandate, and every effort is made to ensure that staff work in a conducive environment and enjoy a healthy life. In addition, the MRA ensures a conducive working environment for its staff by enforcing health and safety policies, procedures, regular health and safety visits, inspections, and ongoing discussions on health matters in health and safety committee meetings. The welfare of the MRA staff is also taken care of through the medical insurance scheme, whereby the MRA contributes to the tune of 70% of the premium for all the staff enrolled. Under this scheme, they can make claims for expenses incurred on various health issues. Apart from that, the MRA has also subscribed to a group personal accident scheme catering for cases of accidents. We have also put in place fully equipped and functional gyms at our offices. Moreover, we encourage our staff to participate in sports and team building activities regularly during the year. I also wish to highlight that the new recruits and existing staff from the Customs Department are able to benefit from regular swimming courses to ensure physical fitness, while other staff are also encouraged to practice yoga and breathing exercises. Since 2006, we have been able to collect about 15,000 pints of blood through the contribution of our staff and stakeholders. We feel proud to contribute to society by being one of the largest blood donor organization in Mauritius. The MRA has always stood up to ensure health awareness among its staff. This Health Week, presently being organized, demonstrates our ongoing commitment to address the health needs of our staff. Ladies and gentlemen, health promotion programs at the MRA cannot be organized alone, since we require a collaborative approach and we need the help of professionals in this field. This is where I wish to again pay my gratitude to the Minister of Health and Wellness. On several occasions with the Ministry of Health and Wellness, since 2010, the Ministry has assisted us to organize general screening exercises for the benefit of its staff. As at date, more than 1,000 staff have benefited from this program. Indeed, the Ministry, through its responsible officers, has always extended its support and assistance to the MRA for the organization of vaccination campaigns for our staff. As at date, the MRA has more than 98% of fully vaccinated staff. The Ministry has also guided us on how to effectively handle difficult situations at the workplace during the pandemic through regular communications. On the other hand, the MRA has also extended its help wherever possible to contribute in the promotion of good health at the national level. In fact, in the past and during the pandemic, we remitted face shields to the Ministry, and we also offered a barometer and multi-parameter patient monitors. I also recall the MRA having donated certain equipments, including television sets, for specific wards in the Victoria Hospital and Princess Margaret Orthopedic Center. This demands the unflinching cooperation between the MRA and the Ministry of Health. Ladies and gentlemen, today's launching ceremony by Dr. the Honorable Minister Jagutpal is again another step in this collaboration between the MRA and the Ministry of Health. This campaign will comprise a series of health screening exercises, talks, and presentations on health-related topics by a dedicated team of professionals of the Ministry of Health. Ladies and gentlemen, I would like to thank the personnel of the Ministry of Health, MRA staff members, and all persons who have directly or indirectly contributed for the successful organization and implementation of this event. I wish to encourage the MRA staff to avail this opportunity for a better health. I thank you all for your kind attention, and I wish you a wonderful day ahead. Thank you.
Ladies and gentlemen, I now have the immense pleasure and honor to invite the Honorable Minister to deliver his keynote address and officially launch the Health Week.
Mr. Sudhamulal, the Director General MRA, Permanent Secretary of my Ministry, Mr. Dasain, Dr. Ori, the Director General Health Services, Dr. Kailesh, Director Health Promotion Research, Directors of MRA, President of MRA Staff Association, senior officials, staff of MRA, distinguished guests, ladies and gentlemen, good morning. So again, delighted to be in your midst today for the launching of the MRA Health Week. Now, why are we here today? We are here today. Are we looking for some exemption of tax? Obviously not. Are we here today to inform you, to give you information on what is diabetes? You're all well aware of. Are we here today to inform you what is hypertension? Definitely not. Are we here today to tell you that it's very important to look after your health because you want to be, to enjoy good health? Of course not. You're all been having an insurance. I believe I won't ask you to raise your hands. I'm sure that you all have been insured and then you're paying monthly like we do pay our pay tax, all that. And you're also having some, amount of your budget going for that insurance purpose. Obviously, because the public health sector is delivering to some status, not like MRA, but yet you prefer to say, I have to be secured to get some insurance, medical insurance for that purpose. But yet we are here today. We know that you're all insured and you won't come to the public hospital. You will attend, obviously, clinics and all that. But yet we are still here today. Nor to inform you about diabetes, hypertension that you know better than us. Nor to inform you at certain age that these days cancer has been prevalent in Mauritius. And you know probably better than us that the drugs used for cancer, one vial costing from 10,000 rupees to 100,000 rupees. And even if you take these drugs, it's going to, your life will last for not more than 2-3 years. You know that better than me because you deal with all those figures and digits. But why yet we are still here to you? You've got a lot of work to do. Yet we say that no, we've got to do that. Years been, we are trying to keep on convincing people, giving information through TV, radio, all kind of, communication campaign that we used. But still, what is the product? Still, you've seen that recently we published the NCD, the Non-Communicable Disease Surveys conducted by, yes, Dr. Kailesh and a foreign team, but still the Mauritian population, the smokers, keep on rising, even if every year your tax is keeping on rising, but at the same time, what is the volume of importation coming on the Mauritius. What's going to happen? Alcohol, should I not say more than that? I believe that you know better than me. Yet, we still have to keep on trying to use all our means to give that information, not only for the sake of giving the information, but for the sake that this information will change your behavior. And changing behavior is a big deal. It's not going to come the next day. It's very difficult to change behavior, especially when it concerns food, when it concerns exercise, and when it concerns health. We feel more protected to see ourselves. We've got an insurance. It doesn't matter what happened to us, because the next day I will be there at the clinic, at the doorstep of the clinic. But it's very difficult to say, no, I don't want to be there at the clinic. I prefer to pay that sum of money, but yet I want not to be there. It's okay. Just like your car insurance, I believe most of you getting a car costing more than 2 million rupees. And yearly, you pay 40,000, 30,000 or more. Would you prefer to say that at the end of your, to pay back 40,000 for your insurance, car insurance? Or would you to say you regret that, yes, I've just paid 40,000 last year. I could have find a way to get back this money. Which one would you prefer for your car? Obviously, you would say, it doesn't matter. I have that insurance. It's a protection, but I prefer to use my car. I don't want to get that, to engage into all the insurance purpose to get back my money. So what we are doing, we Mauritians, including me, we are more having that comfort of, okay, what are the services that would be available? And it's very difficult for us to change our behavior. And changing behavior to make it becoming habits, again, it's very, very difficult. So we are here to give you that information. Just entre parenthèses, we do provide services, but you got to get those services. No one will do and go, even you've got that insurance, will go and do some cervical screening test. I believe you understand, especially the women. What is it? Why we have to do it? How important it is at some age you have to do it. What would be the result? How important it is to have local fruits instead of those fruits being imported? How important is it to get that into our diet? Try to change that. It takes some time. We use all kind of publicity to make it happen, but we feel also this, we call it that personal touch, is also a good way of trying to see, please don't come to hospital. Please don't go to clinic. We can reduce 50% of that work that you're doing. Because the more we need those resources, and the more the work that you are doing will keep on increasing. You can't tell me that 2 years back your amount of work was less, was more compared to today. It will keep on increasing the amount of work because we Mauritian people, we keep on consuming. The more consuming, the more work you have to do. And the more work you have to do, the more efficient you need to be. And to be more efficient, you've got to invest what we call that human resource. And what is that investment? Is change your habit. Changing your habit, we try to do our level best, come to you, get you that information, do the test, try to modify your diet. It's not going to happen the next day. I know it's good to have 𝗪𝗲 and 𝗪𝗲, but let's try to limit it. If you're having it 3 days in a week, try to make it, okay, just do that. I'll do it 2 weeks in a week. If you got to have cold drinks during the summertime, try to say, okay, I'll have half that quantity I was having. Try to change that. That's what our information is. That's what we are here to tell you. And please do these tests. And just don't do these tests only to say, okay, for the sake that the Ministry of Health have come over here, we are doing those tests. But anyway, it isn't going to influence my way of life, my way of doing, my way of, eating and all that stuff. So it's very important to use those tests, but we are here more for your behavioral change. And if that will happen, and if it happens with you, it will happen with the children. It happened that we do say, okay, children, you need to take citrus fruit to take that. But do you do that at the same time when you are telling the children to do it? But you got to do it. You've got to change the behavior, and that at one way, unconsciously it will influence the behavior of your children, of your family members, and that's how it goes on. Otherwise, you will turn up to the G2 hospital at this time. You know the queue. You know very well what is the queue, because we can't do better than this. Thank you probably that you know that you contributed with that budget that you do have, you get, and you give us 10% maybe with this budget. And we do try our best to give whatever we can. And if the same budget, what is required in the private clinics, we should have 4 times that share. Then we will be able to deliver like the private clinics. And that you won't be able to get that much money for us, unfortunately. But we try our level best. That's why the waiting time at the hospital will be long. Try to get things done with that budget. But at the same time, better to tell you, please don't come. You can handle more than 75 of your issues. If you do that, proper food, water intake, less salt, less sugar, cigarette, no cigarette, occasional drinker, a lot of things can change. Obviously, a good dose of exercise. What also important to say, we've got also to look at it that you've got some population suffering from HIV, some population suffering from drugs. But all that will use up your resource. So we've got to change our attitude to those people. If you'll get them, you have a different look at them in the society, in the place where you are living, in that 𝗪𝗟𝗪, quartier, whatever you call it, then things will not improve for the next 100 years. So we've got to change our attitude towards them, get them with us, and then gradually things will change. So that attitude has to change. So if we look health on what we call universal health coverage, on that global aspect, it's very good to look at it individually. And obviously we have to have this message of trying to magnetize it to others, and then gradually to the whole community where you are living. With this, thank you very much. Please, the launching campaign is open. We launch it, and take that advantage and try to influence others as much as you can. Merci beaucoup.
I think we've got the message regarding the behavioral change. We'll try to do our best to inculcate this in the mindset, in the way people behave also at the workplace. Thank you again.